Hi ladies, welcome back. We're here to talk about week 11 of your pregnancy. Welcome back to the ladies that have been with us some time. Welcome to the ladies that have just joined us or are just joining us this week. And some ladies wouldn't even have joined us yet because we find out at different stages that we are pregnant. I found out with my first daughter Ayla that I was pregnant in the first 4 or 5 weeks because I skipped a period. When it came to my second daughter Indiana, I didn't find out until I was nearing the end of the 12th week. So we're all different. Welcome back. Welcome if you've just joined us, and we'll see some ladies in the future. Now by week 11, you've been carrying your baby for 2.5 months. Your baby is now the size of an apricot, which is about 4.1 centimeters long or 1.6 inches long, and it's about 7 grams. That's pretty amazing. Your baby is actually starting to stretch out at the moment and become symmetrical, which is really, really cool, and it's doing lots of stretching and wriggling and rolling around, but your baby's probably still a little bit tiny for you to feel that. Some women do feel like they have popping or butterfly flutters. So this may actually be your baby moving, but a lot of women don't experience that till a little bit later on. Now your baby's head is actually still bigger than its body. So if you went and had a scan, you would notice that your baby might be holding it to one side, usually the left. You can imagine if your head was bigger than your body, it's a little bit heavy, so sometimes it's just resting it to one side. It's completely normal. Now your baby at the moment, its lungs are starting to develop. So it's actually inhaling and exhaling its amniotic fluid, which is allowing its respiratory system to grow. Another thing that's happening this week is your baby's facial features are becoming really, really defined. So it's starting to get a defined jawline, its bones and its muscles in its face are growing, it's getting little ears, and it's starting to get a really distinguishable nose and mouth. Your baby is also starting to produce hair follicles. Now this doesn't mean that your baby's actually going to come out with hair. My first daughter Ayla came out quite bald with this wispy blondie red hair. She didn't have much hair at all. My second baby Indiana came out with quite a lot of really fine dark hair. It doesn't matter. They're perfect, they're squishy and amazing and adorable, and we absolutely love them anyway. Another thing that's happening this week is your baby is starting to grow a diaphragm. So you may notice that it is doing a little bit of hiccuping if you go in to get a scan. And the other thing that's happening is that it's becoming less translucent because your baby is growing more and more and more skin layers. It's actually, as of last week, starting to get little chompers, little teeth underneath its gums, even though it may not be born with teeth, although there are some cases where some babies are born with teeth already protruding from the gums. Another thing that's really amazing is that by the end of week 11, your baby will have quite distinguishable reproductive organs. So it is around this stage or in the next couple of weeks that a lot of women go in to have a scan to reveal the sex of their baby. If you do not want this to happen, make sure you let your doctor know that you don't want to know the sex of your baby, just to ensure that there's no slip of the tongue and they don't ruin the surprise for you if that is what you have chosen to do. Now, some of the symptoms that you may or may not be feeling this week is that you may have more severe cravings. So it was around about this time with my first daughter that I started eating and craving, like you wouldn't believe, Nutella. Now, I had never touched Nutella before, but by the end of my pregnancy, I was literally going through a jar of Nutella a day. I don't advise it, it's not healthy, but just be aware that you may have quite severe cravings or aversions to food. You'll notice that your belly is getting bigger along with your breasts. Your milk glands are starting to grow this week and your breast tissue is becoming heavier. So ladies, comfort is the key. Go out and get yourself a couple of really nice, comfortable maternity bras. I also started experiencing leg cramps around week 11. I was experiencing them at night. This is possibly because I wasn't stretching or finding it a little bit harder to stretch in bed. And this is possibly because there's a lack in some minerals. So just make sure you're consuming a lot of water and you're eating really calcium and magnesium rich food. Once again, you might be feeling a little bit tired. Ladies, from last week, week 10 until week 12, your baby is doubling in size. That is an excessive amount of energy that your body is using to grow your baby. So the fact that you're feeling a little bit tired is perfectly normal. Rest up when you can. And like we discussed last week, you may be noticing a little bit more clearish, odorless discharge from your vagina. Once again, ladies, please, this isn't gross. It's perfectly normal. It's just your body's way of cleansing itself during this time. Now, some of the things that you might like to go and do, like we said, is go and get a bra. Make sure you're eating really nutritious, rich food. Remember your baby is doubling in size. Your body is doing an amazing job, but it takes a lot more vitamins and minerals than it usually did in your day-to-day life to sustain your energy when you were pregnant. So if you haven't already, go and talk to your doctor and grab some vitamins and mineral supplements if that's something that you feel like you need to do. Stay hydrated, ladies. Make sure you rest when you can and take your time to do things. It's only normal that you feel a little bit tired and feel like you need to rest more. So maybe let go of some of those commitments or obligations. And if you're a person that says yes to things that you don't usually like to do, take this as an opportunity to say no and stop doing them. Now, the other thing, ladies, that I'd really like to stress, if you haven't already, is go and discuss the medications that you are currently taking with your doctor. Some medications and over-the-counter medications can actually be harmful to your baby. So make sure you're just taking the right things. And if you are ducking down to the chemist to go and get some tablets for whatever reason or medications for whatever reason, let your doctor or your midwife know and consult with them, or let the pharmacist know before you purchase them and consume them, just to make sure you're making the best choice for your health and your baby's health. Once again, welcome back, or welcome to those ladies who have just recently joined us. I am loving the questions and the comments and the experiences and all the sharing that you are all doing about your pregnancy journey at the moment. So please keep them coming, and I look forward to seeing you for the final week of your first trimester, week 12, next week. Big milestone. You've got this, mama. Well done, and I'll see you then. I'm hiding from my kids, but before you go, do you love this video? And did you want more great pregnancy information delivered directly to you? If so, make sure you just drop by and subscribe to Ready Set Mum using the links below. Good luck.